All right, folks, it is time for our favorite podcast, Cut to the Chase, episode 70. I'm bringing back Dr. Alan Salzberg. How are you doing today?
Good. Thanks a lot for inviting me.
Alan, as all of you know, has been on at least, I think it's 4 episodes already, talking about COVID from not a public health perspective, although it sort of is a public health perspective, but it's more of a data, mathematical, statistical type of look about what's going on and the interventions and all that. Did I sort of do that justice, Dr. Salzberg?
Yeah. I mean, I'm looking at the numbers.
Okay, so Dr. Salzberg does a variety of things as a statistician, does statistical analysis, estimation, modeling, and a lot of his specialty is kind of determining biases in surveys and studies, which is key because a lot of us are relying on public health policy. People rely on surveys and studies or whatever, and the bias in the study or whatever can really affect the outcome. I would imagine you agree with that also, Dr. Salzberg.
Yes.
Okay, good. So today, well, Dr. Salzberg he is the principal of Salt Hill Statistics, which has a website, and on his website, he writes a blog covering a lot of topics, including COVID, and he wrote one recently on masks, which I know everyone, and we're in the Omicron phase, maybe we'll go through another phase. Are you tired of wearing the mask? Does it work or not? But he looked into it from a numbers perspective, and that's what we're going to talk about today. So Alan, Dr. Salzberg, the floor is yours. Tell us what you sort of were looking into, like what prompted you to look into it and what your results were.
Okay, thank you. Well, I'm going to give you a quick background, if you don't mind, about why I was looking into it and why I didn't write about it much until now. So as a background, I kind of tracked the idea of masks as a means of protecting against COVID from the beginning. I looked at the data at the very beginning, and there was no COVID data at the beginning. There was data from other sources, for other diseases. And it was very mixed. Like, it was hard to tell if it worked. That was the status at the time. And my understanding, and if you read what is said about it, the reason they decided to do it is, well, there was no vaccines, and we knew you could get COVID asymptomatically. That became pretty clear. So it seemed like a good thing to do. Let's have people wear masks, and hopefully that'll help out the situation. And it was completely reasonable and, annoying, but like not unreasonable. Like, what else are we going to do? So, social distance. Okay, wear a mask. So that was like 2 years ago. And I've kind of tracked it slowly. And the first study or so was iffy. And then, let's fast forward a little bit. 2 years later, we're at a place where two things happen, and I don't understand why they happen. And I tried to look into it with this blog post. The first thing has happened is we decided very early, like we, not me, masks work. You can't even argue about it. They work. I'm like, oh, okay, really? And then the other thing that happened along the way is that there were a bunch of data analyses, some actual studies, some just what I'll call data analyses. And that's where, there's some problems. So I went back and reviewed all of that. And what I see in that is that so there's two branches. I want to be clear. One branch is, let's blow some air through a mask or even viral particles and see if it catches some of them or if they go out. Those studies are all very clear. The mask stops some of it. Some of them stop more, some of them stop less. They're very clear. So it seems that's another reason why we think the mask should work. The second kind of study is, how does it work in reality? When people wear masks in the public, okay, does it stop disease? Does it reduce infections? And most of those studies show, a lot of them don't show anything statistically. Like the difference wasn't big enough to be distinguishable from random. And then one or two shows a difference, but it's very small. And to me, that was kind of a wow in a way, a surprise, because we've accepted this idea that, well, they must work. I mean, we know they do something. We don't know how much they do. Well, it seems like they may not do anything, or they may just do a really tiny amount. And we're, I know in Florida where you live, it's not true that people are wearing them, but, or not, all people, but, here in New York, for the better part of the last 2 years, we've been required to wear masks most of the time when we're inside. I mean, there's been a break, there was a short break in it, and now we're back to it. And by the way, today they're removing that requirement. I believe we haven't had the announcement yet. So I basically went through, and maybe I'll describe one or two of them to you, but I went through the studies, and I started with, I went through by time, but I started with the first big study that the CDC cites, which is the strongest one in favor of masks of any well-designed study. And by well-designed, I mean, you need to have a treatment group with masks, and you need to have a control group. You need to have a group without masks, because there could be another reason why it's spreading is going down or up in a community. We know COVID goes in waves, whether, no matter what you do, it goes in waves. Sometimes they're big, sometimes they're small. So this was the first study cited, the first human study cited by the CDC in their listing of studies from Bangladesh. And what did it show? Well, one thing it showed, which I think is people have kind of realized, is that non-surgical masks, cloth masks, they didn't find any statistically significant difference in using nothing versus using those in terms of infection in the community. Okay. They weren't testing by blowing air through it. They had randomly, they assigned villages mask wearing or no mask wearing. And not every single person wore a mask when they did this, but they had a much higher wearing of masks in the villages where they went out, they gave out free masks, they told them how great masks were, et cetera, versus villages where the control, where they didn't do this, okay? Yeah. So cloth masks didn't do anything. Surgical masks had a very slight, but statistically significant, I don't want to discount that, but the size of the effect was very small. They found for symptoms of COVID, whether or not they actually had COVID, there were 8.6% was the rate over I forget what period of time, it was a couple months, I believe, where people had some symptoms if they were not in a community with masks, and 7.6. So 8.6 to 7.6, which is about 10% difference. But that was the difference in symptoms. In terms of actually, they tested a large number of people. Most of those people with symptoms, many of them did not actually have COVID. They might have had something else. But for that, the control villages were 0.76%, okay, which is a little less than 1 in 100. And the treatment, the mask wearing villages was 0.68%. So, after all this, a very big study with hundreds of thousands of people, and they had more than 10,000 people in each group with symptoms, a really small difference in the amount of COVID. And so to me, that says masks are, they might work, and this shows something, but it's quite weak. And so to me, that says, well, why are we mandating it everywhere? And like, what is the point of that? Another thing, one more thing I'll throw in about all of these studies, the good studies, unfortunately, they can't be blind, right? If you're wearing a mask, you're aware of it. They found in the Bangladesh study that the people who were in the communities where they pushed masks and they explained the benefit of them, those people also behaved in other ways to avoid COVID. In particular, the thing that they observed was that there was more social distancing. People were more careful about having really close conversations and, you know, what we call social distancing. So we don't know if that, I mean, it could be part of the effect of masks was that, but even if it wasn't that, we're talking about a small effect. So that's sort of like the big study. I don't want to go, I've talked for a while now, so I'm gonna let you jump in. I could talk about some other studies.
All right, yeah, so I have like all these questions, but
Yeah.
all right, so the Bangladesh study, when did that take place, and who created, like, you know, who did the study?
So the Bangladesh study took place, I believe, during it didn't get published until relatively recently, like November. But the study was November 2020 to April 2021. Okay. So it's in a way, it's the most, it's not quite the most recent study published. It might, maybe the second most recent big study published, but you know, it happened about a year ago. It ended about a year ago. And it was like going on 1 year ago today.
And the government of Bangladesh did the study?
No, it was, I forgot who it was. It was a group of, let me tell you, let me check the first author, see what the first author of the studies are. There were, so the main author of the study is at Yale. So, you know, the next author is at Stanford. So these were like at least the first couple, you know, where they were US researchers, but I'm sure there's like 20 people on this study. So it was probably a big international study. So that's, you know, and to me, I did say this a little bit in my blog post, like this is the CDC's sort of keystone study. And one thing I thought is, this is the best you can come up with. Bangladesh, like, are we really that similar? Are there other differences? And I don't focus on that in my blog post, but you do wonder, like, if the best study we could find is in rural Bangladesh in these villages, well, what happened? Like, either we were just really bad that we didn't study it very well here, or we didn't find any good, you know, we didn't find any good good in terms of masks showing a lot of outcomes.
Yeah.
You know, and so when I looked at the other studies, some of them were one of the ones is also cited by the CDC, although not with respect to masks. They ignore this one, but there's another study that's a US study of people leaving healthcare clinics, but that shows that masks aren't having any effect. And I do feel, and I don't like bad-mouthing the CDC. I think they do a lot of great work, but I think in the last 2 years, there have been political biases that creep in. And one of them is that masks work. And that's unfortunate because there's another CDC study, which I mentioned in my blog, that CDC cited. It was reported in Morbidity and Mortality Weekly, which is a CDC, you know, you got to love that kind of the name of that report, but yeah. You know, it's a weekly report about, you know, people dying and people getting sick, and but it was published in there, like, let me just see when it was, about, I think, close to a year ago. But it was a nice study because it's what's called a case control study. It's not a randomized study, and that's one where they look at similarly situated people. They don't make them wear masks or not, but they look at similarly situated people. In this case, people leaving healthcare clinics because they were sick and they got tested for COVID because they thought they had COVID. And then they match up people who actually did end up having COVID with similar people who were also ill, leaving these same clinics, who did not get COVID. And they say, what did these two people do differently? One got COVID, one didn't. Okay, and so they got about 100 and something people from each group and compared all their activities. That's called a case control study. They say, hey, what are the people getting COVID doing differently? And many of the things are sort of exactly along the lines of what we think people do differently. People went to restaurants and bars. There was a high statistically significant difference between people who went to
Indoor.
went to these places and got COVID. For people who knew that they had a contact, much higher chance of getting COVID. Kind of obvious, but it's still good that they tested it. People who wore masks, little bit, lot, sometimes zero effect. So that was another interesting, that was another one of the interesting studies I cited. Now, again, it doesn't mean masks have absolutely zero effect, 0.0, but it's small enough that in this kind of study, it's not statistically significant. It's not bigger than what you would expect at random, and other things are. So it wasn't a tiny study. It was big enough to detect some things, like differences in people who went to restaurants and didn't. There was a difference in COVID that was statistically significant, but masks there wasn't.
Okay, all right. So I'm an attorney. As some of this, I know you're an adjunct professor. You're a statistician. You have your own company. Sometimes people hire you to be an expert witness, and you go to court and you present your position. You have data that you've used to support your position. Sometimes you rely on other studies that other people did, and you say, hey, this is a reliable study. This is what I'm basing my opinion upon. All that kind of stuff. So as an attorney, a lot of times when I'm dealing with people like yourself, expert witnesses that are relying on studies that I have to challenge, I'm like always thinking like, all right, what didn't the study do? So that's where I'm at right now. I'm going to throw out a bunch of questions. You can process it and answer it as you. I'm not going to go one by one. Like I would love to interrogate you, but I'm going to try to just throw them out. Okay. So I'd like to know, have you yourself basically identified all the studies that are out there that have, looked into this, the effectiveness on masks, are the control factors like, are people outside? Are they social distancing? Are they wearing the mask properly? I mean, you're talking about, well, the cloth mask is really ineffective and N95s are better, whatever. All these questions, can they really be established in a study? How many people were in this Bangladesh study? I mean, are these people like outdoors in very hot, humid climates? Is that a possibility? And I'll end my series of questions on this. When I think of masks, okay, I think of two things, two of the benefits that I'm under the impression. And again, we don't have to agree on everything, but there were two reasons why people were wearing masks that I have come to understand. One is if you have it, it'll protect you, the other people, not yourself, but hey, I got it. I'm putting a mask on so I don't contaminate everybody else or infect everybody else. And then the other part of the mask equation was protecting yourself. So it's all over the place and you got a mask on and it's doing that. All right. So did the Bangladesh study and all these other studies that you've looked at, is that part of the equation? I mean, are they looking at, hey, are they looking at the effectiveness of you infecting people and protecting, or is it just, hey, more people are getting COVID or it doesn't have a bottom line effect kind of thing? Because that's what it sounded like with the Bangladesh, is they were just looking at the bottom line and not the protective and all that. Anyway, the floor is yours now.
Yeah, I'm glad you asked that. And let me frame it a little bit though. In my mind, those are all good questions, and a lot of them we can't answer. If you're going to mandate that someone does something, you need strong proof of that thing working. Okay, so that's the tact I came from with this. So when I look at the studies and I see that none of them, that they either showed much or nothing, I say this is not a proven measure. Okay, this is nothing like the vaccines, which have been proven over and over in the real world, in studies, every way you look. Some people say they only work 90%, some people 95%, but no one's saying, oh, there's a 5 or 10% difference between vaccinated and not vaccinated, in COVID or serious COVID. Like the masks, they all show either nothing or like 10%. So to me, part of it is the burden of proof. And yes, it's hard to study. But all of these studies are showing basically nothing. To me, that says, well, there can't be a lot there. Let me address a little bit of the specific questions as well. So there's always this question of, okay, maybe I'm not getting protected, but is it protecting other people? Excuse me, the Bangladesh study was designed to look at overall transmission. So it would look at the combination of protecting yourself and others, because the entire villages were, not that every 100% of people wore masks, but they had a much higher, 4 times higher mask wearing, when they were in the treatment, they had 4 times as much. It went from like 10% to 40% of the people wearing masks very regularly. And even in the villages without, people wore masks irregularly. People had some access to masks, but it was much lower in the control villages. So they were looking at overall as a public health measure. And that's exactly the way that we should be thinking about it. Not you as an individual. You as an individual wearing a mask, the question of, hey, I really know how to wear it well, so I'm getting more protected. That's totally fine for you to ask yourself. But when we're looking at a community and whether we should have a mandate or whether it's good public policy even to do that, we need to say what happens overall with the community, right? Not individually. And so, I mean, I've gotten that question quite a bit, and I have no doubt, like I said, like any study of a physical barrier of a mask shows that the mask stops stuff. So if you have that thing over your face and you do a good job of it all the time is important, right? Then it's going to reduce the amount of virus you spit out if you have COVID and the amount of virus you breathe in. Like, it's a physical barrier that's kind of shown to work. So that's in a way uninteresting, but it could mean that your individual behavior is very different than what's good for the public. I'm not doubting that. I think we need to do other studies. So, I mean, that's a long answer, to your question. One more thing to throw in there, though, to think about with respect to people, to think about on an individual basis, which is a statistical thing, which has not been studied very well. Even if you're wearing a mask well, okay, one of the issues is that, especially with Omicron, I think, the more contagious the virus gets, the mask, you're not going to be able to, one thing is you're not going to be able to wear it all the time. But another thing is, even a good mask, you have a certain percentage, like, they test them and they say, like, even a surgical mask, even a well-fitting surgical mask might reduce, like, if you're putting it on right, might reduce like 70 or 80%, an N95 even more, obviously. If your exposure is, if you only need a half hour of unmasked exposure to get Omicron, which it seems super contagious, well, if you're reducing it by 4 times, well, now you maybe need like 2 or 3 hours. So that sounds really good. And probably for somebody like you or me, who's able to work from home and like is just going to the grocery store, that actually might significantly help us from not getting COVID. However, if you look at a lot of the places where we're demanding them, and in particular schools, 8 hours a day, well, if you needed a half hour with Omicron and the mask gives you, when you're wearing it right, let's multiply it by 4. Maybe it's 4 times, or maybe it's even 90% effective. Let's multiply it by 10. That only gets up to 5 hours if you multiply that half hour by 10. They're in school for 8 hours a day, 7 hours a day, in this classroom full of kids who, at any given time during Omicron, I guarantee you one of them had Omicron. Yeah. And I'll use my daughter's school as an example. I don't like to use these personal examples because we know anecdotal examples don't always work. Her whole school, and I'm in a neighborhood where people are very careful about masking, okay? I'm an outlier if I'm not walking around with a mask. just about every kid in the school got COVID over Omicron. Before that, very, very, very few had gotten it, but just about everyone got it. And they weren't allowed to eat, in the cafeteria. They were, they were it was a very careful school in terms of masking.
Yeah.
And there wasn't a lot of social interaction outside of school. But they all seemed, just about everybody in her school got COVID over the last 3 weeks. So a mask can work really well. It can reduce things 90%. If you have enough exposure, you're still going to get it. And I think that happened with doctors and nurses too, is that eventually a lot of doctors and nurses, even the ones who are doing a great job of masking, I mean, it protects you to a great extent in that case, with everything being perfect, wearing it well, etc. But enough exposure, you're going to get it. So that's an unfortunate fact. But that's just another thought on that.
All right. So are there any ongoing studies that you know of on this topic that you think might shed more light on the discussion?
I don't know of any ongoing studies. I mean, there have been a lot more studies. I cited a few more, and there have been a lot of other studies. I kind of feel like it's been, I don't want to say studied to death, but it has been studied quite a bit and in different ways. And I think, a lot of the ways shed new light on it. There's been studies. There was the Facebook data that, we talked about right before this podcast, that they had hundreds of thousands of people where they looked at masking in schools and found that it had, little to no effect, especially with children. Although again, just like with the Bangladesh study, it did seem to have a bigger effect on COVID-like illness, like it is, which is kind of interesting, like that maybe COVID's too contagious, I don't know. But for other illnesses that were like COVID, it seemed to have a bit of an effect. But then when you went to who's positive testing, it went really close to zero.
Yeah.
In terms of changing the positive testing.
Before COVID, years before COVID, I was in Paris, I was in New York, and I would see Asian people walking around with masks. And I'm like, what is going on? And eventually I met somebody that was Asian that, gave me an explanation, and, they weren't speaking for the entirety of every, person that's walking around the streets of New York wearing a mask, but, they basically explained it like, that they don't want to get the flu. They don't want to get airborne illnesses or whatever. And I was like, wow, even outdoors, it kind of seems a little extreme. I think that to some degree, there's a major cultural issue involved in who is going to wear the mask and who's not. And, I think that in a lot of respects, people that wear masks, they're going to wear a mask. And people that don't want to wear masks, they're not. There's a lot of people in between that are like me. I'm like, do I need to wear it? I don't want to wear it. If I can, maybe I don't need to stand near everybody. Oh, I won't wear it or whatever. So it's kind of, a topic that I think, should have really been looked into a long time ago, because obviously airborne illnesses and the flu or whatever, it's not like these kind of issues or whatever are of no significance on a public health issue. I mean, a lot of people die every year of the flu. So it's kind of surprising that these studies had not been done before COVID, that it really had.
Well, Well, like I said, there were some studies. The studies on the flu were really a little bit like the studies on masks. Like they often didn't show anything. Occasionally they would show an effect. They tend to have stronger results when you look at like a very controlled environment, which is not surprising for some of the reasons you mentioned. Like, well, then people are going to be more careful, and that they're wearing a really good mask and all these various things, as opposed to, hey, people in the subway wearing a mask, maybe not doing a great job. Even those who care, maybe they just don't know how to wear one because they're not medical, they weren't shown how to wear it properly.
Yeah.
Like even well-intentioned people may not always have it doing it right. So they were a little bit like that. And there were some interesting studies, and the CDC actually had some of those on their website before the COVID studies came out. And they were similar in many ways, that They didn't. It's hard to find a big effect, and there are a lot of imperfections in these studies, and that's one reason. But again, if you have something that has a really big effect, like vaccines, you could have any number of, I mean, you can't have any kind of what we call confounding effect, but you can have something that moves the bar a little bit, but it's when the effect is really big, even something that moves the bar a decent amount is not going to overwhelm and show that it's not statistically significant. It'll still be statistically significant, even with these confounding factors of people like not doing it right. And like, you know, like you can imagine the vaccine, like maybe the vaccine, like sometimes it's not put into the right place in the arm, or maybe, you know, some other problems go on with the vaccine. And some people in the real world who get vaccinated, like maybe they're really careless after that because they think they're like made of steel. Like there are confounding factors with vaccines, but nonetheless, when you look at it in the real world, you get a gigantic effect. Like like those effects are drowned out by the fact the vaccine works really well, you know?
Yeah.
But you don't, and with masks, there are many confounding effects, but if masks work, they're small enough to be generally drowned out by the other things. That's really what's happening.
All right, that is going to be the final word from Dr. Salzberg on this topic right now. Thank you for coming on the show. Again, everybody, subscribe, rate, and review. Any comments or questions? Actually, Dr. Salzberg had sent me a little comment question, which sort of led to this show here. And, you know, he was talking about my opiate episodes or whatever. And so I appreciate you following me on that. You know, listen, my guests can follow and they can be my best fans. You know, I love that. But anyhow, Dr. Salzberg, have a good day. Be safe. You know, listen, if you're going to mask up, do it right. And, you know, God bless you and your family, and stay safe.
All right. Thank you.
All right, everybody. Say that again.
Thank you for having me on.
Yes, and a little shout out to one of our mutual friends, Dr. Becker, who's also a mathematician. In his honor today, I wore a pink shirt because I know he's promoting, you know, the male population wearing pink shirts and all that. But just one little shout out to our friend there, okay? So, all right, folks, that's it. Stay safe, and we will return with episode 71 soon enough.